So lots of questions about the cost of dental implants. So what affects the cost?
Every day. Dozens of calls each and every day. Internet, how much is this? How much is that? Patients will call saying that they saw something incredible on the internet. And you know what they say about seeing numbers on the internet? There's 9 things that simply affect the cost of dental implants. And so I want to be thorough. So what affects the cost of the implant? You know, what type of implant? There's something called a mini implant. There's some that are a snap fit implant. So there's lots of different options. There's some that are made out of ceramic. So many different types. And what's misleading sometimes is knowing what is being talked about.
Okay, because we talked about this, where you go online and you see, and you say they're quoting just the cost of a little tiny implant.
Yeah, so sometimes there's the post, there's teeth, is there bone grafting involved? There's so many different things.
Like I see $395.
Yeah, I mean, it's
for
crazy.
the implant here in Los Angeles.
Yeah, kind of makes you wonder.
Do you think it's misleading?
Well, you know, if they're
because there's truth in that. That's what that little implant costs.
Yeah, but if it's misleading about one thing, kind of makes you wonder about other things. And you know, that's only one aspect. So the second thing that affects the cost is how many doctors are involved. So one dentist will see you and recommend that you go to another office, and that other office will take out the tooth, and then the patient has to go to a third office, get the implant in.
So surgery is done elsewhere typically? Okay.
And so the patient isn't aware of this, that they have to go from office to office to office.
So typically 3 doctors are involved?
That's typically how it's involved.
Like 3 offices?
3 offices.
Okay.
Now the way we do it, everything is done in one location. So you don't have to go from office to office to office. And it's much easier for the patient.
Now you actually make the teeth right there. Is that why you do it so quickly?
Well, we're able to do things quickly because of the technology and also our training, which leads me to the third step.
Okay.
So the other thing that happens as far as that affects the cost is the training and the experience of the dentist.
Okay.
So many times the dentist will start off with some very simple cases. If something goes differently or a complication, they may not be as experienced. So what affects the cost is how many people you have to see and the experience level.
Okay.
So the fourth thing that we look at is sometimes the lab bill. There's different techniques and different technology. So with a digital workflow, there's fewer parts, pieces, and components. Sometimes the lab bill that the dentist will get could be astronomical because the dentist may not do these procedures as often as we do. So what happens is by going to an office that does a lot of these procedures, we have our own lab in office. So we're able to keep the costs down.
So you actually make the teeth right there?
Yeah.
You digitally print the teeth?
Digitally print the teeth. We're able to scan. We know exactly. We don't even take impressions. I don't know about you, but most people don't like goopy stuff in their mouth with impressions.
So that's gone?
That's gone. And all these offices end up having to send their impressions across the country. Sometimes they get lost in the mail. It takes weeks and weeks. We can do things same day for the patients.
Very nice.
Unbelievable. And it's less money.
Okay, so it's one doctor, one fee.
Yeah, absolutely. So the other thing that affects the cost is the insurance. So insurance barely covers one tooth for a crown, $800, $1,000. You might be lucky to get $2,000 for insurance, but that's nothing compared to what a patient may need.
What about Medicare and Medicaid?
So Medicare and Medicaid, we hear about that a lot, but you know, they just don't reimburse in our office. We'd love to help, but they just don't pay. And at the end of the day, if a patient is expecting or is told that they'll get something from there, imagine how upset they are when they get a bad surprise.
Okay.
We don't play that game.
So people finance this?
Yeah. So overwhelmingly, about 80% of our patients will finance it. We got a program that's 12 months with no interest. It works out great for patients that are in a position to not have to pay any finance charges. I mean, how nice is it not to have a finance charge? Some of the things that varies and makes the cost different is what the teeth are made out of. So there's probably so many different options. Are they made out of plastic? Are they made out of resin? Are they made out of zirconia? Is it a stock abutment, a custom abutment? There's so many different options, but patients, unfortunately, don't know the
So
differences.
what do you like to make the teeth out of?
So we like to use zirconia. We like to make custom abutments. It's the best way to have things fit because at the end of the day, how many times do you want to have to worry about these things? If it's just once, make sure it's done right
So
the
when you
first
see
time.
some ads online,
Yeah, what are you getting?
I guess if they're made out of plastic or acrylic,
Yeah.
that drops the price. So
Yeah.
you don't want that.
No, and so
Okay.
what happens is patients are led to believe what they're getting is zirconia, which is the best on the market, and what they're getting...
And it doesn't cost that much more, you said.
No.
Okay.
So for a few $1,000s more, you get something much better.
Good.
So the other thing that affects the cost is the warranty and the maintenance. So not every office stands behind their work. We deal with labs, we deal with in-office services, we stand behind the work that we do. The dental implants that we use are an American-made product that has been around for decades, so we stand behind the work that we do.
Good.
Every single case.
Now what else?
So there's two other things I want to talk about. Snap in and snap out teeth. You know, for some people, I mean, years ago when I was just getting started, the easier type of treatment were those snap fits. And a lot of patients are told that they're not candidates for teeth that stay in, that the best thing for them is teeth that snap in and out.
You don't like them, you told me.
Well, you know,
Why?
they're basically dentures.
Okay, it's a snap-in denture.
A snap-in denture.
right?
And you know, it's not that much more difficult for us to take that patient and give them teeth that stay in all the time. Because who wants dentures? At the end of the day, snapping in and snapping out, I mean, yeah, I guess you could snap to it easier, but you know, the issue is people want to chew, they want teeth, and they want to stay healthy.
Nice.
The last thing that I want to talk about is experience and training. You know, I train and teach dentists across the country. And the crazy thing is, in some parts of the country, they charge more than what we charge. So in some cases, you know, I just don't understand why pay more if you don't have to.
But you have the luxury, though, right? To be able to have everything right there, your own lab.
Yeah.
You make the teeth right there.
Well, it didn't happen overnight.
Okay.
This has been a long process, a lot of hard work. I mean, it's been a journey. It's been a process. We didn't just start out like this. I mean, for a long, long time, it took to be able to develop our in-office lab, to develop a digital workflow, to be able to help patients and know how to do it when they come in from out of state, to do everything in one day. It's been a lot of work and effort.
So when a patient calls your practice
Yeah.
and says, how much are dental implants? Before I drive all the way down there.
Yeah.
It's just not that simple.
Well, there's a lot to it.
It would be misleading to even give them a price.
Well, I like to say disingenuous at best and misleading at worst because, you know, how do you know how much bone loss they have? Are they a candidate? Do they need cheekbone implants? Do they need pterygoid implants? Do they need custom implants?
So the only catch is they got to see you.
Yeah.
Will you do like you said you do Zoom meetings, things like that?
Absolutely. We're able to evaluate their bone remotely. All we need is what's called a CBCT. We'll be able to evaluate them.
For people that are like 4 or 5 hours away.
Yeah, people who want to fly in, there's different ways, but even as simple as coming on in, it's a free consultation. We don't charge for the CBCT, a specialized x-ray that evaluates their bone in 3D, and within 10 minutes of coming through the door, they'll know exactly the price, the treatment, how we can help them.
And you have people in your office that help arrange financing.
Absolutely. Okay. So what else is needed other than giving us a call and help you on your first step to making the change to get rid of bad teeth that just limits your life?
No more dentures.
No more dentures, not on our watch.